Okay. First of all, we have to be aware of what does it mean, iron deficiency, if it's related to, for example, exaggerated hematopoiesis. So we use too much interferon, too much iron, and this is why we've got iron deficiency. Or second, because we are doing the phlebotomies. Or third, because there is an inflammation. So in PV, it's mainly related to exaggerated erythropoiesis and phlebotomies. So personally, I don't like do frequently phlebotomies. If I need to do it, so I do them. But usually at the beginning of the treatment, when I see that this patient required too many phlebotomies, I start, if it's young patient, interferon, if it's person that I'm not able to use interferon, so then we have to use, for example, hydroxyurea or ruxolitinib. But of course, we are aware of giving iron to this patient because we may increase once again the need of phlebotomies. So sometimes I use interferon, for example, every 2 days, not interferon, sorry. Sometimes I use iron, for example, every 2 days, and I control strictly hematocrit and hemoglobin level. But of course, we are waiting for new drugs when we can use instead of phlebotomies, pharmacological phlebotomies, because it would be the solution for one of the main problem with iron deficiency. But in Poland, still, we are not able to use this drug. Maybe what we can do, we can use the clinical trials and put patients on clinical trials to use this kind of drugs. But hopefully very soon we will be able to test, for example, Rusfertide in this patient. So yeah.